Hi, I'm Dr. Koushik. I'm consultant pediatric surgeon and a pediatric urologist at Manipal Hospital Sarjapur Road. I'll be talking about a condition called hypospadias. Hypospadias is a condition which is exclusive to boys. It's a condition where the urethra, that is the tube which connects the bladder to the exterior, where it travels through the penis, is abnormal. The abnormality here is where it opens on the undersurface of the penis. The opening of the urethral tube is not at the tip but on the undersurface. This is an image which shows the normal urethra and a hypospadias urethra. You can notice that the urethra, which is the tube carrying the urine from the bladder to the exterior, normally opens at the tip of the penis. But in hypospadias, it opens on the undersurface or the anterior surface of the penis. In hypospadias, it is not just about the urethra but also the surrounding tissues which are also underdeveloped. So the foreskin, which should have been throughout, as in all round the penis, is present mainly on the back of the penis and not on the front. The urinary opening is lower down and not at the tip. The glans penis, that is the head of the penis, also has a deep groove or a cut. So what should have been here at the tip is lower down, and it is not always fixed at this position. It can be anywhere from just below the tip to all the way down till the scrotum. This is a congenital problem where the development of the anterior or the front of the penis is deficient. So there are a lot of tissues like the skin and the deeper tissues which have not completely developed. The urethral tube, instead of traveling all the way till the end, falls short and opens on the undersurface. It's a range of abnormality where it can be just below its normal position or all the way down very close to the scrotum. Along with the abnormality of the opening, there is also a curvature which occurs in the penis, and this is called as chordee. This condition has to be corrected because a boy, as he grows, will have issues where he will not be able to stand and pass urine. The urinary stream will be more directed towards his own legs, and when he is a complete adult male, he will have issues with sexual intercourse. So this condition is treated by surgery, which is better performed between the age of 1 year to 18 months. This age is selected because, one, it's easier to handle the tissues. The growth of the penis is sufficient to hold the sutures well. The children will not have the memory of the surgery being performed and doesn't have any psychological impact. Also, at this age, it is not a hair-bearing organ, so the chances of infection are less. Because of these four important points, the surgery is better performed between 1 year to 18 months. If you can imagine this to be the urethral tube, the anterior portion is deficient and therefore there is only half of the tube which is present. Tubularizing or making this part into a tube will only narrow the caliber. So during surgery, we need to use the tissues in the surrounding to make a complete tube. The foreskin is also deficient. It is more on the back of the penis and not on the front. So this surgery is basically a craftsmanship. It involves art where we need to mobilize the tissues and move them to different areas so that we can regenerate or recreate a normal looking urethra. Once the surgery is performed, most of the time it would look like as if it's just a circumcision has been performed. All the